also encourage parents just to talk to their kids. That sounds so simple. I think it's a missed opportunity for parents to have a conversation with their kids. They often are like, oh gosh, we can't talk about substance use or anything like that because they'll start doing it. Or, you don't want to be that parent. But it's important to have that conversation with your kids. It's a scary conversation to have.
Yep.
Nobody wants to talk about binge drinking with your 16-year-old.
Substance use disorder touches all our lives, and often we feel hopeless or frustrated in our pursuit to understand how and why it happens.
Welcome to APC Recovery Cafe, where we discuss the topics and trends around substance use, provide education and resources, offer recovery support, and also discuss prevention tactics, all through the stories of the people who have been there.
We invite you to grab your favorite coffee or tea and join us for a variety of guests that will bring understanding, information, connection, and hope.
Together, we can break the stigma and pave a brighter future for each other.
Hi folks, welcome to this episode of APC Recovery Cafe. I'm Art Wimberly. I'm a person grateful to be in long-term recovery, and I'm a volunteer at the Addiction Prevention Coalition. And our co-host in the studio today is Carrie Wimberly, the Executive Director of APC.
Hey, Art.
Hey.
Glad to be here today. Excited to have Ashley Loftis with us. Ashley is a staff member at APC, so this is our get to know the staff section of the podcast. So welcome, Ashley. Thanks for joining us. And we're going to learn some things about Ashley today, but Ashley serves as our Prevention Navigator at APC. And what that sort of means is there's a grant called the LEAP grant, and you're going to have to, okay, what does LEAP stand for? I've lost it.
Yeah, so it's Project LEAP. It's a 5-year SAMHSA grant, and LEAP stands for Linkage, Education, and Prevention.
So this is our first grant that we have actually partnered with another organization, and we're halfway in the middle.
Yeah.
2.5 of 5 years. And it really is focused on the intersection of substance use and HIV, infectious diseases. So can you talk just a little bit about that?
Yeah, so Project LEAP, like I said, is a 5-year SAMHSA grant. So we partner with UAB Medicine and with Dr. Ellen Eaton, who's an infectious disease doctor at UAB. And we work to educate young adults between the ages of 14 and 24 on substance use prevention and HIV prevention, because often with substance use comes some risky sexual behaviors or just risky behaviors in general. So just giving them some education on the risks that come with their substance use. We also work really closely with Dr. Rebecca Savage at Children's of Alabama as well, because she has a substance use clinic that's specific for adolescents. So we get a lot of our participants from there.
Okay, well, I want to talk more about that in just a minute. Before we get too deep in, we always start with the beverage of choice.
Yes.
So tell us what this is right here.
Yeah, a vanilla sweet cream cold brew from Starbucks.
There you go.
Yeah, so I'm not typically a coffee drinker in the morning. It's usually a late afternoon type. Got to get through a couple more hours of the day. So this is different.
Treat.
Yeah, it's a treat.
So sometimes I see you drinking something that's pink too. What is that pink drink?
That is it's one of two things. So it's either a peach green tea lemonade with a strawberry refresher base, or it's the strawberry acai refresher from Starbucks as well.
Wow.
Yeah.
Okay, so we try to learn something about the person based on their beverage of choice. So what does this say about you?
Ooh, I don't know. It's very basic, but the cold brew is very unique. I will say that. It's got a very unique flavor. The cold brew in general is very unique. So.
Yeah, Raven introduced me to the cold brew. I hadn't tried it before, but it is very good.
It is.
Yeah. All right, so let's go back to tell us where you're from and introduce us to young Ashley. So,
yeah, so young Ashley, that's so funny because I automatically want to say she's just a science nerd. It's young Ashley. But so I'm from Western North Carolina. I moved here to go to school at UA in 2013. So I've been here for almost a decade, which is wild to think
Oh my gosh!
about.
Wow.
Yeah. So like I said, grew up in Western North Carolina, super small town outside of Asheville and like right off 40. So I describe it to most people like if you've driven past Asheville to get to anywhere in North Carolina on Interstate 40, you've driven past. Where I'm from, it's just a wide spot in the road. And so where I'm from was heavily impacted by the opioid epidemic. I often describe it when we've been doing interviews with new staff members. If you've seen Dope Sick, it's very much like that. So like having all the industrial plants there and jobs that are dangerous like logging and all those types of things where people are getting hurt and being prescribed opioids. And then it just kind of spiraled.
Yeah.
As it did everywhere else.
Yeah.
But yeah, I went to an awesome elementary school. I fell in love with science there thanks to my third grade teacher, Miss Childers. And I've just really loved it ever since, and I've loved learning. My mom will tell you that I used to cry because I couldn't go to school. Like if I was sick,
Oh wow.
I would like, oh my gosh, I can't go to school and just be all to pieces.
Avid reader, I bet, even as a child.
My
Really?
mom would argue that.
Really?
Sometimes I hated reading, but something I love, then yeah, I'm about it.
Interesting.
Mm-hmm.
Okay, so had thoughts about what you wanted to do, or just knew it was going to be about science?
I knew it was probably going to be medical related. My mom works in medicine. I've always been fascinated by medicine, so knew it was probably going to be something related to medicine. I originally wanted to be an orthopedic surgeon when I moved to Alabama.
Oh wow.
Very fascinated by bones and all that, and specifically sports medicine. But then I ended up really falling in love with psychology, actually thanks to one of the psychology teachers I had in high school. And I fell in love with it when I got to Alabama and decided to change my major, and then ended up being a counselor somehow.
Wow. So your original major was what?
It was biology and pre-med.
And then changed to psychology?
Yeah, so I changed to psychology and minored in sociology and addiction and recovery.
Okay.
And addiction recovery is now a major at UA. It was once a minor, but it's really become very popular, so they changed it to a major.
Okay, so got that degree, and then so many degrees. so take me through, and then a master's degree.
Yeah, so
Okay.
I graduated from UA in 2016.
Okay.
As I say, I didn't want to go home yet, so I moved to Birmingham and got my master's at UAB in counselor education with a concentration in clinical mental health. And now I'm actually working on my PhD in counseling and supervision through the University of Holy Cross, New Orleans.
Oh my gosh.
So learning has been a big deal to you from way back, right? Trying to kind of get behind we know what's happening, but why does it happen? Has that been a big deal?
Oh, yeah, totally. Yeah. And I mean, I feel like I do that in my day-to-day job here with especially patients that I see at the adolescent clinic. Okay, how did you get here? What are the factors that got you involved in substance use? And what are things that you've experienced that have, exacerbated your anxiety and depression, things like that?
Okay, yeah.
So let's talk about the adolescent clinic, because I mean, before I got here, actually before the whole Project Leap, I knew very little about the adolescent clinic. So I'm thinking I may not be the only one. So it's part of Children's of Alabama, and what are the patients that are being seen there as far as ages and issues?
Yeah, so the adolescent clinic is most definitely a hidden gem, specifically Dr. Savage's substance use related clinic. So I want to say they're seen all the way up to 21, but adolescents are seen there for a variety of reasons. Young women are seen there for like menstrual issues, just general adolescent physicals for sports, things like that. But then Dr. Savage's substance use clinic as well. So she sees kids that maybe are at risk of developing a full substance use disorder, already have a substance use disorder, or their parents are concerned, or their primary care physician's concerned, or their school's concerned about their substance use, and then they come to the adolescent clinic and see her. So
the referrals come from other doctors, or is that how they get there?
Yeah, so they can come from other doctors. They, if a parent's concerned, they can call as well and
make an appointment.
And did you say also that sometimes it might be someone in the school system that points something out?
Yeah, so sometimes, especially in the school system, it's probably the school contacting the parents and then going from there.
Starting the ball rolling or something like that. So what's your point of contact most of the time? Because obviously you do research as well, right? But you have some points of contacts with individuals in that system?
Yeah, so typically what happens is when I'm at the adolescent clinic on Monday mornings and Wednesdays, Dr. Savage has patients that she feels like would be a good fit for Project LEAP. So they do a survey for us. They do it at what we call baseline or 0 days, and then 30 days after that, and then 90 days after that. And the survey just asks questions about their prior substance use over the past 30 days and also their perception of risk. So it's really interesting to look at, the substances they have been using over the past 30 days. And it really does, it's really helpful to inform how to educate them. So they may be completely unaware that using multiple substances all at one time is dangerous. Vaping, using marijuana, alcohol at the same time puts a major strain on your body. So being able to gather more information that way and then educating them.
Okay, yeah.
So I guess we're 2.5 years in. Mm-hmm. So anything you can say about what you've learned, what we've learned just from this process? I know we're in the middle, analyzing data, et cetera, but just for you personally, having worked with these kids, what are you learning?
Oh gosh, I hate to say all the kids are using substances, but sometimes it feels that way, but I know it's not true.
Yeah.
Just seeing so many kids vaping and then so many kids just using such a high abundance of substances, and they have no idea what the risks are that come with those. And then also I've been surprised by so many kids that put themselves in risky situations to obtain those things.
Yeah.
Well, that you use the term, this thought of risk, and I know a big deal with prevention and recovery work is the perception of risk. And a lot of work goes into trying to figure out where we are at any given time in a culture as to perception of risk. And I think, if I'm not mistaken, the research or the numbers more recently seems to show that perception of risk has really gone down in, I would say, in this country, but perhaps in the current youth. Does that make sense, or is it changing a lot, or?
Yeah, I can totally see that. I will say, just by looking at some of the surveys, it seems like perception of risk of like opioids and opiates, they perceive that as higher than other substances. Yeah, which is good.
Maybe we've done some work. Some good work there.
Yeah, that's totally a win. But I think kind of throwing ourselves into prevention in that area is taken away from prevention in other areas.
Yeah. So, coming from a parent, now a grandparent perspective, is there anything you can educate parents on about their use, how they're obtaining, anything that parents need to know or can, if they know, could be helpful in educating their children? Any gleans of information?
Oh, that's so good. I think we all know Snapchat's a problem because the messages go away so quickly. And then also like the Snap Map of being able to basically pinpoint where a person is a problem.
Okay, tell me what that is, because I don't know.
Yeah, so on Snapchat, it's an app where you can just take a quick picture and send it to somebody.
Okay.
There's also like a chat feature on it, and so your messages can go away instantly, or I think after so many hours.
Yeah.
But then there's also a map, and you can pinpoint like down to a specific room where somebody's located. So like if I had my Snap Map on, you could see that I'm in this corner of the building. So it's that detailed.
Wow.
So how are people using that to get their drug of choice delivered or get access to it? And not be detected.
So, like I said, it goes away real quick. Anybody can look and find you on the SNAP map. But then also just being able to really contact whoever. Everybody has usernames, so you don't exactly know who you're contacting. You can get their info from Instagram or something like that. But yeah.
Well, and I think a lot of that's, one of the messaging points that we're trying to get out as much as possible for caregivers, parents, and grandparents is that so much of the purchasing of substances is happening through these apps that the kids are using. Also, I just saw an article this last week talking about the messaging that kids are constantly exposed to and bombarded with around vaping, around now, marijuana coming through those apps. So
Now, are you saying that the messages they're getting are positive toward them using?
yes,
Okay.
encouraging use.
Yeah.
So they're being educated that, the perception of risk going down is not just accidental. There's a lot of different factors that go into that. But one of those is media, and sort of causing the perception of risk go down, but also glamorizing it, at younger ages around movies and all kinds of things. But there's banner ads that come and go on these ads, as the kids are on there. It's almost a subliminal thing about substance use.
And I would also encourage parents just to talk to their kids. That sounds so simple, but I think it's a missed opportunity for parents to have a conversation with their kids. They often are like, oh gosh, we can't talk about substance use or anything like that because they'll start doing it. Or, you don't want to be that parent. But it's important to have that conversation with your kids. And
do you think another reason parents don't engage in the conversation you're describing is because they don't feel educated themselves sometimes?
Oh, yeah, I can totally see that. I know a lot of parents have said, oh, my gosh, I did not know that. I had no idea about whatever substance or that could be a side effect or something. So I think there is some hesitancy with not feeling educated enough to have that conversation. Yeah. Plus, it's a scary conversation to have.
Yep.
Nobody wants to talk about binge drinking with your 16-year-old.
Yeah.
Which is, one of the roles the Addiction Prevention Coalition is trying to play in this space in Birmingham and in Alabama is actually finding ways to educate everybody, but especially parents, and trying to find venues and ways in which we can reach them. And that's sometimes very difficult. It's kind of the last thing a parent wants to do when they get home at night is to go to a meeting about this.
Right.
So we're having to try to find different ways to get prevention messages out. One of them is through what you guys do, but it's actually coming in from a different direction, coming through the clinic and the kids, right?
Yeah. And when we get in front of parents, one of the things we try to remind them is that parents are the number one reason that kids choose not to use alcohol or substances. And as parents of teenagers, you think they're not listening, and they're not, in preteens, they're not. My voice doesn't have weight anymore, but that's just not true. But another thing that we've learned is that, and this is something, if I could go back when our children were struggling, I would do it differently. But threats, shaming them or whatever doesn't work. But what we have learned is that the kids want to be treated as people that receive information, just like Ashley, the science nerd, and trying to give parents the education so that they can have a conversation with their child to provide that education so that they know what they're dealing with, because you can't always trust your peer, what they're going to tell you. Okay, so one other topic that I know you're interested in is harm reduction.
Oh my gosh, yes.
You see your face light up there. Okay, so for people that don't really know what we're talking about, tell us what harm reduction means in this space.
Yeah, so harm reduction in this space means giving people resources and education to use safer. So obviously we know people are going to do what people are going to do, and we can't stop all substance use, although we would love to do that. But we can give them resources to hopefully prevent overdoses and prevent the transmission of infectious diseases like hepatitis C and HIV.
Okay, so tell us what that looks like.
Yeah, so in Alabama, it looks very, very unique. So we recently, I want to say June 2022, fentanyl test strips were finally legalized in Alabama to have in your possession because they were one time considered drug paraphernalia. So if somebody had them, they could go to jail. With the overdose crisis that we have going on, now we can provide people with fentanyl test strips so they're able to test whatever substance they're going to use ahead of using that. So that has been a major harm reduction thing that APC has been involved with. I want to say we've given out probably over 2,000 fentanyl test strips, and we pack them in this little pack where there's 5 in an envelope, and it has an instruction card in there for them to have education on how to use the fentanyl test strips. And we also put some community resources in there as well, information on never using alone, information on how to get in the naloxone through the Jefferson County Department of Health as well.
So one of the initiatives that I think has come out of our federal grants that has not been something that we've done in the past is our pop-up resource fairs.
Oh my gosh, yes. Our pop-up resource fairs, which are also our perfs, as we have lovingly labeled them,
yes,
is an opportunity for us to be involved in the community, because often we can be in our offices doing our thing, but it's good to actually get community level with the people in their space. So we work really closely with JCDH, so the Jefferson County Department of Health, to determine overdose hotspots, which JCDH does through their OD2A grants. And that informs us of where we need to go. So we just did a pop-up resource fair in Inslee in an overdose hotspot area. And we were able to train, I want to say JCDH trained about 40 people.
I think it was 44.
Yeah, in naloxone administration, and actually gave them a kit on site. We were able to give out a little over 500 fentanyl test strips, I think like 550. And then just provide people with education and support. And I think that's a big part too, like going into those communities and letting people know that like we see them, we hear them, we're here to support them as we can, and hopefully get them to a better place.
And I think it's important that the facet you described of when we're doing harm reduction, it's not as simple as just like giving the test strips, because those are contact points with real human beings that a lot of other information can be given to them. As you said, other resources. Maybe they want to stop altogether. Can we get them into a detox, into recovery? Can we connect them with a counselor? So there's a lot more going on at the point of contact. Yes, it's harm reduction, which is important when you keep people alive, right? If we're going to ever help them deeper. But those points of contacts provide a way for us to get people the potential to get deeper or bigger help. Does that make sense?
Yeah.
I mean, I think Candace, she's been on our podcast before, but at that particular resource fair, watching her with people in the community is incredibly inspiring. I think this is one of the initiatives that came out of our other federal grant that I think as a staff we are the most proud of, even though it's a very simple setup, and we invite our partners. Ross was there. Depending on Fellowship House comes out sometimes, depending on where we are and what the community is like that we're serving. people, I mean, it's literally like we just say, hey, let's just meet at this place. People show up, the tents go up, and then order some pizza, and it's just being out in the community and really trying to serve people, and meet them where they are, you know, and give them a sense, like you said, of there are people that care, and there are people that are resources that are available, when you're ready to reach out and get that information in their hand. And there's something that happens. I don't know, when they see that there are people that are working in a space that they really feel like somebody cares about them. That's as important as what we're handing them, I think.
Oh, yeah, totally.
Because so much is about hopelessness, and thinking that people don't care.
So it's the venue you work in is where something that you're really good at, like research, is then actually translating into actually meeting people's needs, right?
Oh, yeah.
So you've got your master's that's related to counseling, but I know just from your personal story, I don't think you see yourself as the kind of person that's going to spend 8 hours a day in your future doing individual counseling. So can you tell us a little bit about kind of how you see some visioning for the future as you're pursuing a PhD, and you've already got a master's that's related to counseling, and you've always been concerned about this idea of substance use and the problems it causes in communities. Do you have some kind of a vision for the future for you where you tie all those things together?
Yeah, it's so funny that you said that. I don't want to do counseling 8 hours a day. I have zero interest in that. I learned that pretty quickly, that's pretty brutal for me to have to sit and listen for 8 hours a day. That's exhausting. And I really love community level work. I really love engaging in the community with people, tying in the research aspects. And in the future, I mean, I would still love to do this type of work and then also incorporate some teaching as well to educate people on substance use, especially counselors that are up and coming, or undergraduate students kind of through the addiction recovery program, the addiction recovery major at UA, educating young people like that.
Yeah.
So,
great. That's a great vision.
So one more thing I wanted to ask about was, I have seen and heard your passion for kids that are justice involved. So tell us a little bit about how that happened, how you figured that out, what that feels like to you.
Yeah, so that just kind of randomly happened. I was working with Backpack Buddies, my old job with Vineyard Family Services in Shelby County, and they had just gotten a grant through the state and then also a federal grant through OJJDP as well. And we were already doing some prevention work in the juvenile detention facility in Shelby County with the BOV and life skills. And I just had an opportunity to become more involved with that and make that my primary role in working with kids that were justice involved on kind of all levels and with their families as well. I really came to love all of those kids, as difficult as some of them were. I really came to love all of them. And I just really love getting to know them and their backstory and how they became involved in what they're involved in. And a lot of them I come to know just really wanted attention. They're like, oh yeah, I'm just acting out because I need attention. All these other factors are going on and I feel like I'm not seen or I feel like I'm not heard. So I would often say when people would be like, oh, so-and-so's so bad or they behave so poorly or whatever, I would never have that experience with most of them because I feel like that I was allowing them to feel seen and heard. So we had a really good working relationship. I didn't really have any issues with them. But, I've always been interested, like I said earlier, in the backstory of things and how people get to where they are. So also working with people that are incarcerated as well, because it's not usually just something happens one day and they end up there. It's usually an ongoing list of things that get them to where they are.
Well, and I think it's interesting because we bring our gifts and talents to this place, and then we find our space. So I think while some people might find those situations to be more difficult to serve in, for whatever reason, you find those places and people like really that's your space. So it's almost as if you can take in that past or the difficulties that they're having, and that doesn't cause you discomfort. You feel more comfortable in that space. So I don't know if that's about your personality.
Well, it kind of speaks a little bit to your ability with an analytical mind and a rational mind. Does that make sense?
Yeah.
You can separate where some people would get overwhelmed with the details or the emotions
Yes.
of that. You're built, it seems like, to which, okay, I can handle this through the analytical and the rational, and that's a way in which I can actually help people.
Yeah, serve through that.
It almost draws you in from the mind's viewpoint into a more personal relationship in which you can relate in a different way. Even the idea that you talked about, these are folks generally, they're younger. At some point, their story got off track. By the time you meet them, things are problematic, and you want to kind of know the why. How did we get here? How can we help other people not go down that road? But also, now that we know where you are, how do we help you analyze this and get back on track? It kind of draws you into a protective mode for people, but it's almost more through the mind than through the emotions or the will.
Oh, yeah.
Yeah. But then you're willing yourself to help, if that makes sense. Yeah. So that's become a passion for you without you actually looking for it, I guess.
Yeah, I most definitely was not looking for that. It just kind of happens. So.
It reminds me of, I joke with Ashley because, okay, so one of your things is crime
Oh, yeah.
podcasts.
Yes.
Okay, she loves them, and you listen to them before you go to bed or as you're going to sleep.
Sometimes, yeah. I listened to one getting ready this morning.
Okay.
So for some reason, they actually calm you or make you more balanced or centered, or
I don't know what that says about me, but yeah, I guess you could say that.
whereas I know my wife well enough to know she would be disturbed for a month.
Yes.
if she tried
So
to
like
do
we
that.
get ready to watch something at night, and I'm like, okay. He's like, what about this? And I was like, no, it makes me nervous. I cannot watch that,
Yeah.
and then try to go to sleep.
Yeah.
So, but that's not. It doesn't keep you up.
Yeah, not at all. I've always been very interested in true crime. I probably get that from my maternal grandmother, who was very into true crime as well.
Oh, that's sweet.
Yeah.
And it's not that you want to commit crimes.
No. I want to solve them. Let's get that right. I want to solve them. Yeah, so very interested in true crime. And also, like, I think the appealing factor, once again, is how people get to where they are. Like, how did you turn into this terrible person that commits these horrible crimes or whatever? But then also, especially the unsolved ones, the analytical part to try to solve them, or looking for details in the research that other podcasters have done to be like, oh, I wonder if there's a connection. So
Yeah, solving the mystery kind of.
yeah. It's
Well,
disappointing.
and Ashley is my resident FBI agent. So if I ever need to know anything about anybody or about, something going on somewhere, I'm like, Ashley, can you figure out what's going on here? And boy, Heidi,
The researcher comes out.
she
Oh,
can
yeah.
figure it out in a like that, and it's always accurate.
I just think it's fascinating that kind of that inborn ability you have to research over the years has come into connection. What can be really dry and up in the White Castle, is down now on the ground with people who really need that in order to change their life. So is that what gets you up in the morning now? Other than Carrie says you got to be at work at a certain time.
Yes. Besides having to be here at 8:30, just knowing that I'm having an effect on people, working in prevention, you don't often see the immediate
It's hard to
effect.
measure prevention.
It is.
Yeah, it's so icky because you can't measure it and see like an immediate change. But you know, having that impact, and know that I'm having an impact, and then also, you know, I think about there's so many systemic issues happening around treatment, mental health, substance use, things like that. And if I don't get out of bed in the morning and go like try to do something about this, who's going to?
Yeah.
So that's what gets me up every day.
So we always like to close with our guest addressing the audience and just saying something about if this is going on, or you're thinking this, or you're lacking this, we've got a way to connect you to resources. So think in that space that you work in, that's with kids or juveniles and their families, and what's a misconception that somebody out there might be thinking that you can give them some different information, or what's an invitation you can give to folks to connect to resources?
And we can refilm this, but I would say that there's a misconnection with mental health resources. We know that. And I would just really encourage people to advocate for their fellow people. You know, there's a major shortage in mental health beds for people, especially kids, because I also work at Children's with the psychiatry team as well. And, you know, kids are having to wait for multiple days to get a bed at a safe place, you know, to receive treatment. So I would just encourage people to advocate for children and their mental health, people with substance use disorders. And
Okay, so tell me what advocate means. What does that look like?
I mean, speak up about it, whether it's like a post on social media, if it's a retweet on Twitter, or, you know, just having the conversation with somebody else. You know, I think people think advocate, I have to write my local congressman, somebody like that. But I think it's much simpler than that.
Yeah.
And just raising awareness about what's going on.
Yep.
And
Meeting them where they are.
meeting them where they are.
Acknowledging what they're going through.
Yeah, that too. And then just
Getting the help they need.
yeah, getting the help they need, and really just caring about people.
Yeah, we're constantly trying to work on stigma, you know, around substance use, but stigma with mental health issues, especially children
Oh yeah.
and adolescents, is a real need. Yep. Well, thank you so much.
Yes.
It's been a joy getting to know you and to work with you. I'm thrilled with the work that we're able to do through Project LEAP, the connection with UAB and Children's. It's been a sweet one, a good one. Lots of great relationships there. So thanks for joining us today.
Of course. Thank you for having me.
Yeah, thanks. Well, folks, join us next time on another episode of APC Recovery Cafe, as we'll introduce you to another person working in the field of prevention and recovery and what we're learning together. Thanks.
One of the things that APC is known for is being a connector, because we're stronger together.
Not only are we there for those who are suffering through substance use disorder, but we're there for family members, and we really take our job seriously.
We all have personal reason why we're in this field. We're changing people's lives one community at a time.